The simulation centre is as close as you can get to an actual ward. It's just a safe place to practice your skills that enable you to become the best you can be at what you want to do.
SimX is a simulated mass casualty event. It takes place all over kind of the greater Portsmouth area with multiple exercises going on, with multiple students involved and multiple agencies as well. And it just allows not only hospital environments but also disaster response environments to be able to test their mass casualty processes and protocols to make sure that we deal with it in the best way that we possibly can.
The event today we've based on a traffic accident. We've got actors playing the parts of patients, various injuries, some relatively minor up to some pretty serious stuff, and unfortunately a few people that didn't make it.
Last year we did one day full of adult casualties. This year we've doubled the days up and we've added a paediatric element in, which allows QA and our students to be able to prepare themselves if the worst ever happened, and we did have a lot of children needing attention medically at any one time.
It's a really rare opportunity to be involved in something that's in such big scale as in SimX. The students of course do have placements. They have to do 2,300 hours to be put on the register to be a nurse, but to get this experience where there's a mass casualty situation would be very, very rare for them.
A lot of the time students have to take a bit of a backseat role when stuff like this comes in clinical placement. Being able to do it in a controlled environment allows the students to be able to kind of practice their skills that they're going to have to be doing when they qualify and when they come across a major incident in real life.
By seeing this and working together with the QA team here now, they're getting such valuable learning experience, and if they ever have to deal with this in the future, it will allow them to be more confident and competent practitioners.
I believe that getting this experience as a student opens my eyes to what actually happens in the real world. I feel like I've had the experience where I can implement them skills into anything that I come across.
There are so many different aspects of the multidisciplinary team within the hospital setting, and being able to understand each other's roles and communicate with each other and work together is what optimises patient outcomes.
This will help me in my future career because of all the experience that I've gained and insight of what it's like to work with a different type of teams, for example doctors, consultants, other nurses, and it's good for communication and team working.
20 of my student nurses I've directed up to Tipner. They're going to be involved in a humanitarian exercise, and they'll be working with the crisis and management team. And the idea is by putting student nurses in those roles is they get to see what it's like to be on the other side, to feel vulnerable, to feel empathy for that person in that situation.
It's about recognising the roles of others, seeing the impacts that they can have, and I think it's just about taking those transferable skills that our students have and putting it into a different situation.
Nursing isn't a traditional ward-based approach. Some of the students here could go on and work for international aid agencies. It is really important that they have an awareness of the kind of pressures that they could be involved in.
There's negotiations that have to be undertaken with local important people. There's interviews with the media to show off their organisation and develop relationships. They face a series of other challenges such as passing checkpoints and to access and assess a particular location as to its suitability to develop into a refugee camp or a camp for internally displaced people. The better we can make that experience now, the better equipped they'll be when they go into that world in the future. SimX allows us to offer an exercise environment to other organisations external to the university, such as voluntary organisations, sometimes local authority, emergency responders, United Nations organisations, civil protection organisations from around the world. And then sat behind all of that, because we're a university, there's a huge amount of research that goes on.
This experience will really help the students in their future careers. It will really make them feel safe, confident and competent going forward. So if it becomes a reality, which we do have major casualty incidents, then they will feel more confident as a team all together to work together and hopefully get a better outcome for everyone in our community.